Hi, I'm Chris, and today I'll be administering medication via IV. So the first thing I need to do is gather my equipment, which I already have. I have my medication cart, my alcohol prep pads, my 3 milliliter syringe, and my medication. Next thing I need to do is I need to make sure I have a good knowledge base of that medication I'll be administering. I need to know the special considerations, I need to know the dose, the actions of the medication, the purpose of the administration, adverse effects, and I also need to know the administration rate of that medication. So I've already done the calculations for the medication itself, so today we'll be administering 1 milliliter of medication out of a 3 milliliter syringe. The prescribed rate for that medication is 1 to 2 minutes for that 1 milliliter. So 60 seconds over the 10 lines, and 1 milliliter is 6 seconds per line. So that's our rate. Second thing I would do is I would take my medication cart and bring it outside the patient's room, and then I would perform hand hygiene. So once outside the patient's room, I would unlock the medication cart using the correct code. This is also time where I'd look at the medication administration record, and I'd also look at the medication itself. Is it the correct medication? Is it the correct time to give the medication? Is it the correct route? And I would also double check patient allergies within the medication administration record, and then I would compare the medication administration record to the medication, double checking the expiration date of that medication and if it's in stock or not, which it is. So I have my medication here, so now I'm going to draw the medication. So I've already performed hand hygiene, and I'm going to put gloves on as well. I'm using an alcohol prep pad on the top of the vial. So now I have my 1 milliliter syringe with the correct medication in it. I would shut the medication drawer, and I would lock it, and I would leave it out here, and I would take my medication into the patient's room with me. And of course, I'm only administering medication to one patient at a time. Alright, so we're in the patient's room now. First thing I need to do is I need to identify the patient. So, good morning, could you please state your full name and date of birth? He states his full name and date of birth. And I double check that on his ID tag or bracelet. So I've confirmed the identity of the patient. The blind's already closed and the door's already shut to ensure privacy. And now I'm going to assess the patient while I'm here. I'm also going to assess the patient's IV site as well for any sort of swelling, bruising, pain, tenderness, inflammation, or infiltration of the site. So the site looks fine. And then I'm looking at the tubing as well, making sure it's not kinked, there's no blood in it, and it's intact. So once we've done that, I also need to make sure that the patient doesn't have any allergies to the medication. So the patient doesn't have an allergy bracelet on, and I could double check that with the medication administration record. I would also have another check of the label, the expiration date, and the dosage at this time. So I'm going to prepare the site. So what I'm doing is I'm anchoring the IV to the site using my fingers, and I'm going to clean the port that's closest to the IV site before administering it. So as you can see, I have the tube in between my fingers and my non-dominant hand, and I'm anchoring the tube down to the IV site. Still anchored down, and we're attaching the syringe. So once again, I said it was going to be the rate for this medication is going to be 6 seconds per line. So I'm using my watch. Then I'm going to inject at 6 seconds for every line. It's going to be a very, very slow, continuous push, and it should take a minute to administer. So to save time, we'll say 60 seconds has elapsed. I'm releasing the tubing, and I'm unscrewing the syringe from the port. The syringe is going straight to the sharps container right now. So the tube's been released. At this time I would restart the IV pump if I needed to, which this patient wasn't hooked up to an IV pump, so I don't need to do that. I would reassess the patient's IV site one more time. I would remove my gloves, wash my hands, I would document everything I did, and I would reevaluate the patient later.